Good evening, everyone. Hi, this is Brian Torchin with Healthcare Recruitment Counselors. We're doing our very first live introductory video to medical staffing in the chiropractic profession. I'm going to kind of go over an introduction into what we can do to help you source medical professionals in your office. Kind of go over some of the benefits, and at the end, we'll take some questions from anybody that has any. Again, my name is Brian Torchin, and I'm with Healthcare Recruitment Counselors. We provide staffing solutions for the chiropractic profession. I'm a New York Chiropractic College grad. I graduated there in 1995, and I've been in practice ever since. I currently have two locations in the state of Delaware where we have a multidisciplinary model. And I started staffing for chiropractors back in 2000 and formally formed Healthcare Recruitment Counselors back in 2006. Our goal at HRC Staffing is to find you medical staff by the fastest means possible. Usually, when you hire us to do a search, we'll have candidates in your inbox within 72 hours. Currently, we're working all over the United States, so whatever state that you're in, we can find you medical staff. A question I get is, why use your company? Why use HRC Staffing? One of the biggest reasons is that we offer a customized solution to whatever it is you're looking for your practice. So if you're looking for an associate chiropractor to work coverage while you're on vacation, we can help with that, and we can fill that void immediately. If you're looking for a medical doctor to work 1 day a week or 1 day a month, we can help with that. If you need a full-time physiatrist or a neurologist or an orthopedic surgeon, whatever you need for your practice, we can help find very fast. Again, usually within 72, 96 hours. If you're looking for a physical therapist, a physical therapy assistant, whatever you need for your practice, we can help find. And that's the most unique part of my company, is the customized solution. So we don't have a cookie cutter approach. Whatever it is you're looking for, whatever requirement that you have for your practice, that is what we will find quickly and efficiently. So what do we place, and how can we help you, and what are the benefits of medically integrating your office? Well, of course, first of all, we help place chiropractic associates. So if you're looking for an associate doc, an independent contractor, possibly someone to buy in or buy out, we can help fill that void for you. If you're looking for coverage work, let's say you're going on vacation for a week or a month, or you're going out on maternity leave, whatever it is you need, I can help find a chiropractor very, very quickly. One of the things about doing a medical model in particular, and maybe not everyone on this call is doing a medical model, maybe they're just thinking about it, but once you start getting into the medical model of chiropractic, you get very bogged down with paperwork and staff issues and HR issues. And a lot of times you're going to need a chiropractor to help you with the overflow of work. A lot more goes into it administratively than what you were used to before as a regular chiropractic office. So I always recommend hiring a chiropractor to help you with your patient flow, especially when you're very first starting out in this integration model. We can also help you find medical doctors, all specialties. Generally, what I see in an integrated model, though, however, especially when you're first starting out, is hiring a family physician, a general practitioner, or an internal medicine doctor, and somebody that has experience with joint injections, trigger point injections, or just examining patients. I recommend doing that on a part-time basis to start, just to get your feet wet, and then as you get more and more confidence in that model, you can expand the hours from there. So generally my clients who start out doing an integrated model will hire a family physician part-time, maybe 2 days a week, a few hours each day, just to do some regular DME bracing, examinations, trigger point injections. As they get busier and they get more confident, they'll increase the hours to possibly full-time. Later on down the road, my clients have been doing this for a few years, they'll hire a neurologist who specializes in pain management, or a physiatrist who also specializes in pain management. And those are the docs that can really do more of your technical procedures like C-arm guided fluoroscopy, EMGs, NCVs, epidurals, spinal cord stims, things like that. And those require advanced surgical center build outs, and that's something down the road. We can also help you find that staff if you're a chiropractor already at that level and you need help finding a neuro or a physiatrist. We can help fill that void. A lot of my clients also hire osteopaths. And the thing about osteopaths is they're the same, everything's the same about them as a medical doctor. The difference is they go to different schools. MDs go to med school, osteopaths go to osteopathic school. 4-year programs are both. After they're done with those 4-year program, they go into residency. The residency programs for the MDs and the DOs are exactly the same. And MDs and DOs will attend the same residency at the same time. So they'll pick a track. They'll either go to a neurology track or an orthopedist track or a surgical track or a family medicine track. And in those tracks, you'll have medical doctors and DOs. So after school, there's really no difference. The biggest difference is that a DO in school learns how to do osteopathic manipulative technique, or OMT. And a lot of chiropractors, that's a good service to provide not only for the patient, but also from a billing standpoint. They'll have the osteopath actually do the adjustment. Just depends on your philosophy and what you're looking to accomplish. But if you're looking for a DO, we can also help with that. We also place physical therapists and physical therapy assistants. Generally, my clients will hire a physical therapist either on a full-time or a part-time basis, and then bring on a physical therapy assistant to assist a physical therapist. You cannot hire a physical therapy assistant without having a physical therapist on staff. They work hand in hand together. We also place physician assistants and nurse practitioners, PAs and NPs. These are really, anyone starting out an integrated model, the PA-NP route is really an important route. They're really your workers in the office. They're the ones who are going to see the patients on a day-to-day basis. They're the ones who are going to do your DME bracing. They're the ones who are going to do your trigger point injections and things like that. The model that I really like, and of course it has to depend on if your state approves it or not, and you should always be working with a healthcare attorney. And if you need help finding a healthcare attorney, I can help you find one. However, a PA and an NP together with a supervising physician is a very nice way to go. Generally, you can have the PA or NP work part-time. Their hourly rates are considerably less than a physician. And then you can have the physician work 1 day a week or 1 day a month or whatever the state that you're in requires to supervise. And that generally means coming to the office, reviewing charts, things like that. And those are the specialties that we place. So what are the big benefits for your practice by an integrated model? Well, for those of you on this call who already do the integrated model, I'm sure you can attest to the benefits. Yes, there's a lot of extra paperwork. Yes, it's a lot of work. Yes, there's a lot of HR issues that go into this, and there's a lot of billing and coding and things that you need to get brought up to speed with. But once you're brought up to speed, the benefits are huge. Obviously, you're able to bill for services that you were not able to bill for before, such as injections, DME. Even your exam codes are different. Your physical therapy codes are different. Everything becomes different, and the billing becomes a lot more beneficial for the office. The patient benefits are huge. Patients can do everything for the most part under one roof without having you to make a referral out to a physician in your area. The patient can get everything done in the office, and that's a huge benefit for the patient from a time perspective, from you collaborating with the physician from that perspective, knowing what's going on with your patient. It's very important for the patient, and the patients love that type of cohesion within the practice. So it's great for that. And there's a huge benefit for the owner doc, yourself. Your patients are happy. You're bringing in more revenue for the practice, so you're able to pass that on to your employees. Perhaps you're able to bring on health insurance for them and 401ks, and now your employees are happy. So these benefits are huge. It's not without work in the beginning. It's like anything else. When you first started a chiropractic model, there was billing and coding. issues. And now there are billing and coding issues with the medical model as well. You just need to really bring on a very skilled healthcare attorney, I recommend. And I work with healthcare attorneys all over the U.S. I can make recommendations if you need one. So let's say you wanted to go this route and you wanted my help with staffing. What do we do for chiropractic owners? Well, one, as I went over before, we provide a professional staffing solution. So if you wanted my help, I would send you an agreement. We'd go over it on the telephone first, and once it's signed and sent back, the first thing I do is I email blast your job out to thousands of candidates in your area. And that's really how I'm able to get qualified candidates in your inbox within 72 hours. We aggressively go after them. We don't wait for them to apply for jobs. I have an extensive database with email capability, and that's a big way on how we get candidates to your office right away. Every day that you don't have a doctor or a nurse practitioner in your office is a lot of money going out the door. And if you already have a medical doctor or a nurse practitioner or a PA and they quit, well, you know how important it is to find somebody very fast. And that's what I provide is speed. So once I have a candidate that's interested and has applied to my job, I personally do an extensive phone interview with them to make sure that they're a qualified candidate for this type of job. Not everyone's going to be. Not everyone wants to work in an integrated chiropractic office. Some MDs don't want to work with you. Some PAs and NPs don't want to work with you. I weed through that. I find good candidates, and I let you know who I have. Once I have somebody good, I go over that with you on the telephone, and I'll help you schedule a phone interview or an in-person interview. If that interview goes well and you want to move forward with the candidate, I'll help you with contracts and negotiations. I walk you through every step of the process. Another question I get is, what are the fees? How do the fees work? Well, we are a contingent-based search firm. So what that means is you don't pay anything up front. We have a no-fee guarantee, okay? If I don't find you anybody, you don't pay anything. We don't take any money up front. We're contingent-based. Contingent meaning you have to hire somebody that I send you, and then the fee is payable. And the fees vary based on specialty. So, a fee for a chiropractor will be different from a fee for a PA or an NP, and for a medical doctor it'll be different, and for a physical therapist it'll be different. Fees generally can be anywhere between $3,000 on the low end to anywhere from $8,000 on the high end. It really just depends on what you're looking to hire, whether it's full-time, part-time, etc. But whatever the case, we could certainly help you, and our fees are quite modest as compared to other firms. So those are the fees. If you want to connect with me and post your jobs yourself, I can help you do that. If you have a job and you want to try posting it yourself first just to see if you get any action that way, all my connections on the 3 social media sites are all physicians, medical professionals, and they're always looking. I always blast my jobs on those social media sites. So if you wanted to blast yours on there as well, that's fine. Be my guest. You can find me on Facebook. It's just my name, Brian Torchin, T as in Tom, O-R-C-H-I-N. LinkedIn, it's under the same, Brian Torchin. And for Twitter, it's just Healthcare RC, like Roger Charlie. So what I want to do now is kind of go over some questions that people have about the services that I perform. Someone had a question earlier about if there is ever a charge if we hire your company but do not hire one of your candidates. So again, is there ever a charge if we hire you, HRC, but then we never hire a candidate? The answer to that is no. It's a no-fee guarantee. We're a contingent-based firm. We only charge if you hire a candidate that I send you and they actually start working in your office. Another question I got, I'm looking for an MD or DO to work 1 day a week or 1 day a month in your office. Can we help with that? The answer is yes. HRC we have an extensive database of medical docs looking for these types of relationships and who like working in a chiropractic integrated model. Another question I got earlier, how are we different from other staffing agencies? I used a lot of other staffing agencies before. It didn't really work out that well. Well, there are literally thousands of healthcare recruiters in this industry. Very few of those recruiters work with chiropractors and is actually a chiropractor. And not only will we find you a chiropractor, but we'll also find you medical doctors, nurse practitioners, PAs, and PTs. Another question I got was exclusivity, meaning one person asked, they already signed a staffing agreement with another agency. Doesn't that preclude me from signing with you? And the answer is no. We have a non-exclusive agreement. So that means you can work with my company, you can work with 10 other staffing agencies, and you can try to source the position yourself. Remember, you only pay my firm if I send you somebody that you hire. Background check. Someone had a question about background checks. I have a full, and this is a separate premium service that we could provide. Whether you have your own staff already and you want to run a background check on, I have the capability of running full search background checks. Depending on the staff that you have, it can include criminal and civil, federal, state searches. If they're licensed professionals, I could do the National Practitioner Data Bank check. I can run credit checks. I can run DMV checks. Whatever checks and backgrounds you want me to run, I can run for you. Whether you're hiring the staff from me or you already have the staff that you're considering hiring or have hired and you want to run a background check. I have that capability. The turnaround time for that is 48 to 72 hours. I get the form filled out by the employee or the person you want to have checked, and I run it through my software, and I get a nice report. So if anyone has questions about that, they can certainly ask me about that. We can kind of go over the process and the procedure on that. Temp cover. Someone wanted to know about temporary coverage for chiropractors. Can I help with that? Yes, I have a huge list of chiropractic associates looking for jobs. They're more than willing to do coverage work, and we can find coverage docs very quickly for your office. So if you're ever in need of a coverage doc, think of HRC Staffing. We can definitely help with that. As I said earlier, if you're going to be doing a medically integrated model, you need a healthcare attorney to do this. Please don't try doing this on your own. You need a qualified healthcare attorney that only does healthcare law. If you don't know one, email me at healthcarerc@gmail.com or call my cell at 267-251-5275. I have healthcare attorneys all over the U.S. that I can refer you in your state, and that will help you. It's crucial to use the right team to set this up. In closing, we're going to be doing a monthly video stream. So if there's any content that you specifically want to know about, send me an email to healthcarerc@gmail.com and let me know what you're interested in hearing about. Like I said, we're going to be sending out invites and letting you know about the new content in the video stream on Facebook, and you'll be getting an email blast with the dates for the next one. But if there's anything in particular that I left out on this one that you'd like to hear about, let me know, and I can certainly help you help with that. If there's no more questions for tonight, it's been a pleasure speaking with you. I look forward to many more people joining the program. So if you know of any other chiropractors out there that can benefit, have them sign up. And thanks again, guys. If there's no more questions, that's it for tonight. We'll speak later on again. Okay? Again, Brian Torchin, HRC Staffing. Thanks. Have a good night. Bye-bye.